Alberta doctors are sounding the alarm over overflowing capacity in Alberta hospitals. The Alberta Medical Association is asking the government to take immediate action to prevent the situation from getting worse.
Our system is failing, and eventually the hospitals just don't have that capacity.
Dr. Troy Peterson says physicians like him, part of the general internal medicine teams in Alberta hospitals, are struggling to keep up with demand. The teams are specialized, able to help with complex medical needs.
When GIM goes down, so does the hospital system. We're now at a point where many hospitals' GIM teams have run out of both fingers and toes to plug these holes, and we no longer have passed the capacity to help.
The Alberta Medical Association blaming the province for escalating the crisis, calling for immediate action.
We gave government in the fall of last year a hospital stabilization plan that clearly highlighted and said, these are some of the struggles we're going to have. And unfortunately, government has not moved at all, not one step on that plan.
Alberta Health Services saying recruiting doctors is difficult internationally. In a statement to City News, AHS says since 2019-2020, the general internal medicine workforce in Alberta has grown by roughly 11%, and individual zones manage workforce planning to address diverse practices and local needs. But the AMA is calling for more, as it's in the middle of negotiating with the province to bring in more physicians and update after-hours incentives.
The most pressing concern at hospitals that are imminently failing is going to be, what are we doing to support the care of patients after hours?
In response, the Office of the Health Minister saying we already incentivize after-hours care. In 2023-24, physicians received approximately $200 million in total in after-hours time premiums. But the AMA saying incentives should not only be offered to doctors but other healthcare professionals as well.
We need to look at not just after hours and weekend coverage for physicians to be incentivized, but maybe for some of these other allied health people to be incentivized, because it's odd to all of us that the hospital has a weekend. It doesn't.
In Edmonton, Hiba Kamal-Choufi, City News.